the everyday nightmare of the cataract surgeon. The medical literature says 1 to 2%. Super surgeons, perhaps 0.5%. The most common serious complication in cataract surgery, the dreaded break in the posterior capsule. Result, vitreous loss, prolonged surgery, less than ideal IOL placement, and increased risks of endophthalmitis, endothelial cell loss, macular edema, retinal detachment. Can rates of posterior capsule failure be brought close to zero without having to be a super surgeon or having decades of experience? Yes, I believe they can. Proof? To date, a run of 3,615 cases with only 2 cases of posterior capsule failure, less than 0.06%. The answer? A technique, hybrid Phaco, and a mindset, professional pilot. So what is hybrid Phaco? Hybrid Phaco is a safety-first approach to cataract surgery. It is a hybrid of divide and conquer and Phaco chop technique. The Phaco chop portion is a hybrid of horizontal and vertical chop technique. The key concepts are the double wide, double deep trough, and 3D fracture. But before those key concepts, approximately in sequence are the other principles. Always keep in mind the 3 fragiles of the anterior chamber. Greater speed, shorter time are secondary. Respect inertia. Never let things happen faster than your own reaction time. Watch for whole lens movement. Flatten the anterior capsule. If in doubt, make it smaller. Small volume but high velocity pulses for the first wave. Rotate the nucleus slowly and gently. Make a central groove almost 2 Phaco tip diameters wide and 2 Phaco tip diameters deep. Alternate sides, stepping down only half a Phaco tip diameter each time. Additional width allows the surgeon to better use depth perception. Stepwise progress assists in judging depth. Adequate depth for effective fracturing can be obtained without risking breakthrough to the posterior capsule. It is a safe, stable maneuver that allows assessment of the anterior chamber environment with little risk before moving on to higher risk phases of the procedure. How dense is the nucleus? How loose are the zonules? How stable is the anterior chamber? How well is the equipment working? Are all questions that can be easily answered during this phase. Place the Phaco tip solidly, but not necessarily deeply, into the nuclear structure to be fractured, 1 mm proximal to the fracture epicenter. Place the tip of the chopper 2 mm distal to the fracture epicenter. Pull the chopper toward the Phaco tip, pressing slightly downward. As Phaco tip and chopper almost meet, the chopper continues movement toward you, continues downward into the nuclear structure, and moves left. The Phaco tip continues pressing away from you, lifts up, and moves right. Fracturing efficiency is greater. No substance can resist force in all 3 dimensions. Close proximity of the 2 instruments makes for a smaller field of view and an easier technique. Instruments can stay safely close to center. Instruments move short distances, easier for small pupil and small capsulorhexis situations. Nuclear fragments move short distances, creating less stress on zonules. The nucleus can easily be broken into many small segments for easier removal. The 3-layer removal technique Keeps as much material between the phaco tip and posterior capsule for as long as possible. Recognize the safe zone of the phaco tip. Always maintain a clear line of sight between the surgeon's eye and the phaco tip. Keep the phaco tip as close to dead center at the capsular plane as possible. Feed the phaco with the second instrument. Use sawmill technique if necessary. Rotate all larger fragments bimanually. When pulling a nuclear fragment into the center, use your second instrument in 2 stages. Stabilize the adjacent fragment. Once the nuclear fragment is loose, move that second instrument over to delineate the nuclear fragment from its epinuclear companion piece. Use the natural tumble for nuclear fragments or epinucleus. Watch the capsular rhexis edge at all times. Suction only enough to take hold, then zigzag motions to loosen. Polishing, if in doubt, don't. For hybrid phaco to work, you have to study and understand the principles, follow them to the letter, follow them consistently, even when shortcuts beckon. So how do you do your phaco? Like a street racer or professional pilot? The street racer may have much by way of skills, knowledge, and experience, but he goes from point A to point B as fast as his instincts tell him he can get away with, in hopes that nothing unexpected occurs to cause an adverse outcome. The professional pilot always considers the worst possible event that might reasonably be expected to occur, and manages his aircraft in such a way as to allow for avoidance of, or safe recovery from, such events. Even when the weather is clear, he goes by the book of instrument flight rules. All the principles, techniques, and tips will not do you a bit of good unless you follow those principles consistently and to the letter. If you do so with hybrid phaco, your final approach will be to an intact posterior capsule. Have a safe flight.